Topic today is an exciting one because it is about reinventing Michigan. If you go back to the original top 10 list for the reinvention of Michigan, number 9 on that list was reinventing our healthcare system. And the topic today is let's move forward with that. When I did a health and wellness message last year, I specifically talked about Blue Cross Blue Shield as an opportunity to modernize our system there. They've played a great role in the history of our state. If you look at the history of Blue Cross Blue Shield, they go back to, I believe, 1939 and have been a major contributor in terms of health care coverage. They cover millions of Michiganders' lives. But if you look at it, their regulatory scheme goes back to Public Act 350 of 1980, which was 32 years ago. And at that time, part of the regulatory scheme that was put in place is they were essentially made the insurer of last resort and had a fairly unique status in our state. Times have changed. And if you look at where federal law in particular is going in terms of health care, it's getting much more to an open marketplace where under federal law, insurance companies will be required to provide insurance to individuals, regardless of their health condition. So this is an excellent opportunity to say we should update. We should move to the 21st century with our rules and regulations to keep up with that and actually make sure we have more cost, quality, and access to health care to our citizens. And this is a good way to do that. So what we've done is put together a proposal to reform how we have Blue Cross operate in our state. So we put together a legislative package. We put together a package to work with Blue Cross Blue Shield and their board of directors on. And it does several things. One of the first things it does, it will transition Blue Cross Blue Shield. It's a relatively unique status. It's going to transition to a nonprofit mutual insurance company. So Blue Cross will be a marketplace competitor. It will be working under the normal insurance regulatory rules. And if you look at it, it will be a player that can compete with everyone else in terms of offering hopefully lower cost, better choices of health care to all our citizens. And I think that's exciting. As part of this process, though, there are several other unique attributes that I think are exciting. One is they have had a strong social mission. As part of that, they're going to be contributing a significant amount of money to a nonprofit. That amount of money will be $1.5 billion, approximately $1.5 billion over the next 18 years. And that will go into a nonprofit that will have an independent board, and that board will focus on how those dollars can be deployed to ensure better health care for our citizens. One other feature I'd mention as part of this process is they will remain a Michigan organization. The idea here, this is not a sale of Blue Cross Blue Shield. And the point here is we want them to play an important role in our state, so they'll be continuing as a major presence in Michigan, and hopefully a successful organization that's creating jobs, that's providing great health care. Well, great. You can see why I'm excited today. This is good stuff.